A very good afternoon and salam sejahtera. I'm Dr. Selva Kumar Sibapuniam, the Malaysian Pediatric Association President, and I would like to welcome you to our public forum today, COVID-19 vaccination among children, why should we vaccinate? And this forum will be conducted in bilingual. Selamat sejahtera, selamat datang ke public forum yang dianjurkan oleh Immunize for Life Malaysia dan Malaysian Pediatric Association. Forum ini akan dilakukan dalam bahasa Malaysia dan bahasa Inggeris. Seterusnya saya ingin menyerahkan forum ini kepada moderator kita pada petang ini, Datuk Dr. Zulkifli Ismail. Datuk, the platform is yours.
Thank you very much, Dr. Selva. First of all, welcome to this webinar. And I'd like to thank Dr. Selva because it was he who mooted this idea. And just a few days ago, and then in the last few days, the Immunize for Life Secretariat, as well as everybody, had to work pretty hard. We have some housekeeping announcements that we need to tell you first before we get on with the forum, so that we get the rules right. So if the Secretariat could just flash the housekeeping announcements. Basically, all your mics will be muted, and your questions and answers can be asked on the Q&A chat group on the in Zoom. And if you are on Facebook, I think you have some problems getting through to Facebook now. So I think the Secretariat is trying to link you up with YouTube. But if you can get to Facebook, then go to the comment section and ask your questions there. Is the slide ready from the Secretariat? So anyway, and if you have, please do not use the chat. If you use the chat box only for if you have issues with the with your connection, or you have problems trying to link up with the group. So now I'd like to we actually have a short poll before we start this session. So if we can have the poll, the first poll, please, from the Secretariat. Can we have the first poll? Okay, we don't have the polls. All right, so we don't have any polls to ask from you. Basically, we wanted to know how many of you have actually had reservations. And the idea of this webinar is actually to answer all your questions and also allay some of the doubts that you have regarding the COVID-19 vaccine in children. As you know, the ministry has already started the rollout for children, and we are actually supporting it by giving this webinar, and we hope that we'll answer all the questions that you have in your mind at the moment. Now, we have 4 panelists this afternoon. Of course, 2 of them is pretty well known to most people on social media. Dr. Musa Muhammad Nordin, who is a pediatrician and neonatologist at Damansara Specialist Hospital, but he's also served for decades in the Ministry of Health Hospital before. Dr. Amar Singh is a senior consultant pediatrician, a community pediatrician, and he is an activist who is involved with many NGOs, and he is from Ipoh. We have also Associate Professor Dr. Anis Siham Zainal Abidin, and she is a consultant pediatric intensivist who deals with intensive care patients, and she is with UITM, and she's practicing at the UITM hospital as well as Hospital Selayang. The 4th member of the panelists is Dr. Fong Siu Moy, who is a consultant pediatric infectious disease specialist. So she handles all the infections probably in the state of Sabah, because she's from the Sabah Women's and Children's Hospital, NICAS, in Sabah. So we have a very good team here, all pediatricians, but all in various subspecialties that should be able to answer most of the questions that you would have in your mind, and hopefully we will have cleared some of the doubts. We also have interactive sessions, so if you have questions, please put them through so that we can answer them. There are already some coming up already now, so we'll try and answer them towards the end. But for now, we'll start by dividing this into two. The first part of it will be a short one on the disease itself, on COVID-19. Then we go on to the vaccine part. So for the first question, I'd like to ask Dr. Fong Siu Moi from Sabah. This is a question which many parents have, and this is regarding COVID-19, which is supposed to be not serious in children and also not affecting as many children as they are affecting adults. So what do you have to say regarding what people think at the moment regarding this issue?
Thank you very much, Zub, for the question. Regarding COVID-19 infection in children, it's a misperception that children do not get COVID-19. So if you look at studies overseas that was published and all that, it's been said that in New York and in the US, the incidence rate of COVID-19 among children, young children less than 5 to 11, and adolescent group is similar to the incidence of COVID-19 in adult. So the incidence of infection is similar. The only thing that is a bit different is that many children are asymptomatic. They don't show obvious signs and symptoms. Therefore, parents think that they are not infected. So if you test them, you'll find that they are equally as likely as adults to be infected by COVID-19. Okay, and also other studies have shown, like serology, when they test the blood, also prove that the incident rate of positivity, antibody positivity in children is similar to the adult. It just shows that they are as prone to COVID-19 as in adult. Thank you.
Okay, all right. That's, so we know that it is not as rare as we think it is. I just want to pose a second question to Dr. Anis, who is a pediatric intensivist. And can you give us some examples of some of the children who've been admitted into the pediatric ICU and go through with us the cause of the disease in these severely infected children?
Yeah, thank you, Dato'. So working in a PICO means that I see the extreme end of the situation, like the severe COVID infection, category 4 and 5. And also there's another entity that is related to COVID, which is called multi-system inflammatory syndrome in children. We call it MISC. So although the number presented, if you look at comparing with the adult, the children are infected with a severe disease in children is not as many as adult. But one life is not just a number. One life is so valuable that you wouldn't want to, lose that even one life. And it could be any one of us, could be our children, it could be our family members. So these children are usually very, very sick. And they often, in a severe COVID-19 infection, the lungs are the organ of target. But I do see children that comes in with neurological seizures. They come with fits and seizures as their first presentation, along with vomiting and diarrhea, and also some chest discomfort, chest tightness and palpitations. The other entity that I was talking about, which is the MISC, it is first described in April 2020 in the Western countries. And it wasn't until the second or the third COVID wave that it came to our shore. If I can share you something from this talk that I myself personally, I wouldn't want any parent at all experiencing their children having this illness. It is something that we should not take things lightly. And if having vaccine will be able to help and inshallah help to prevent the disease in these children, then maybe it's something that you really need to think about. So if you look at the FDA review of the doses that has been given, 8,000 hospital admissions and 150 of COVID-related death, and a lot of children in the US was admitted to ICU. almost 5,000 occur of MIC occur in this age group between 5 years to 11 years old. So being able to have something to prevent this severe disease of fatality would be a critical indication.
Thanks, Dr. Anis. I think a lot of parents want to know what symptoms do they look out for in children with MIC that you've mentioned earlier?
Yeah, so for MIC children, they can come with a lot of symptoms, but mainly the target organ is the heart. So if you look at the cases that we have seen so far, I think my personal experience, I've seen around at least 35 to 40 children who come in with MIC. And the main thing that they come in with chest pain, chest tightness, and for the older children and the younger ones who can't really complain, they will just become very lethargic, not active, and they have a lot of vomiting, diarrhea, and sometimes they can have seizures, can have fits as well. So these are very, very like non-specific, but what I would like to imply here is to get these children checked in the hospital so that we can actually catch them early.
Right, thank you very much. Just go back to Dr. Fong. There's this entity called long COVID. Would you like to elaborate a bit about long COVID, and then what and how many children actually get long COVID?
Okay, long COVID is a phenomenon that you get after you got COVID, and the definitions of long COVID varies from one place to another. But by and large, people has adopted, if you still have symptoms 3 months after COVID, after you have got COVID from the date of your COVID positivity, then you have persistent symptoms 3 months, then you have long COVID. Long COVID symptoms can vary. It can be physical symptoms. It can be also psychological symptoms, such as you can get lethargy, fatigue, okay, cough, persistent cough. You can have a bit of loose stool, dyspnea. So it varies from one person to another person, or difficulty in sleeping, okay, mood change, mood swings, and all those things, behavioral problem and all that. Okay, so when we look into long COVID incidence in children, among our children, a quick survey among my colleagues and doctors who deal with children with COVID find that our incidence over here is not high. We have a very small number of children with long COVID. Generally, long COVID among children, the incidence is lower than adult, but it's still significant. So because if this children has long COVID, it will have some impairment on their long-term behavioral problem and also progression and all those things, and health and all that. So we should take this seriously. Long COVID is something serious that can happen to our children who develop COVID. Yeah.
Okay, there's a question about long COVID patients. Are they still infectious?
No. Long COVID patients are not infectious anymore. That's right. Because they have persistent symptoms, but most people think that the symptoms are due to some sort of autoimmunity that persists in that particular patient. But the true pathogenesis is still not very sure yet. A lot of scientists are still looking into it, but they are not infectious. They're just having some lingering symptoms, and they are not themselves yet from prior to COVID.
All right, good. Thank you very much. I think that answers the questions very well. And we just answered the first question from Joe Tong earlier on. Dr. Amar, the next question is for you. You know, you've written a lot and it's come out in Code Blue on schooling and all that. Would you like to at least discuss about the long-term psychosocial issues on children who are deprived of this face-to-face education that the current generation has been facing for the last two years? Amar?
Thank you, Sue. I'd first like to say that, the best data we have right now is from UNICEF on this. They've done 4 studies looking at some of these issues. And we've also got data from Ministry of Education saying that 40% of children have not been able to access online learning. So it's not just face-to-face, but a lot of children have had almost very minimal schooling, even when we moved to online. The UNICEF data shows that 1 in 5 inner city children in our country don't want to go back to school. They've lost interest And that's very devastating for our children because we know how important education is. There's very good data from China and other countries showing that a lot of children, as much as 20-30% of children right now suffer from post-traumatic stress disorder and struggle with anxiety, with depression, with suicidal ideation. I would not be surprised if this is similar problems in our children. We already have a mental health problem. The National Health Morbidity Survey has shown that. Now I suspect that we have a mental health pandemic among our children that is worsening. So I believe that we need to get children back to face-to-face learning. It's a time to meet and socialize. But having said that, it is still impaired. I watch children in school buses. When they go into school, they don't talk anymore because they're scared. Even in school, everybody is masked and there's limited socializing. So I worry about the impact of this long-term on friendship development and our social development. There is also a group of children who have not met other children. They were born during this pandemic. Some have never gone to kindergarten, not met other children except maybe their own brother or sister. And these children will have a very steep learning curve when they meet other children to learn how to interact with each other.
Yes, thank you, Ahmad. That's true. I mean, a lot of my patients now who were born during this pandemic actually have this fear of strangers outside of the parents. Even their grandparents also, they have a fear of them. So this is something that we really have to deal with, and probably we have some data 20 years from now when these children grow up. The next question, we're going to go now switch to the vaccines now, since Dr. Musa's forte is really the vaccine, but all of you here are pediatricians, so you are all experts in vaccines as well. So please chip in whenever you need to, including the president, Dr. Selva. Musa, the issue here with the vaccine is that people are afraid of the so-called new messenger RNA technology, and there are many who are actually waiting for Sinovac to be given to children. So could you just comment on this? We'll give you a bit more time because this is an issue that's been plaguing parents, and I get a lot of these questions from the parents here. So Musa, all yours.
Need to unmute, Musa.
Unmute, please.
Yeah, Assalamualaikum, peace and blessings. Zul, Amar, Anis, Fong. Must make mention of the Executive Committee of the Malaysian Pediatric Association and Stephen and his team from Immunize for Life and all listeners online today. In my opinion, the main concern of most parents is the safety of the vaccine, especially the mRNA vaccine. In Malaysia, it's Pfizer because it is the only recommended vaccine for those between 5 and 11. Now, let me reassure all the parents, healthcare workers, that the data from the US CDC is very, very good. It is very, very reassuring. Now, because they have the largest experience with vaccines, with Pfizer in kids aged 5 to 11 years old. They have used 8.7 million doses of the Pfizer vaccine. And most of the reported AEFI, adverse effects following immunization, were not serious. The main adverse effects were pain at the injection site, fatigue, and headache. This is actually very, very good. It is a good sign that the child's body is building protection, is generating, neutralizing antibodies against SARS-CoV-2. And the vaccine efficacy is 91%. That's as good as some of the vaccines that we use routinely in our children. But there's only one major adverse effect, and this is inflammation of the heart, myocarditis. Now, they've used 8.7 million doses. There were only 11 cases of myocarditis. And all of the 11 cases recovered fully. Yeah, they all recovered fully after 2 to 7 days. So if we were to create a rate so that we can compare, it was 1 per million. 1 case of myocarditis per million doses of Pfizer vaccine. Okay, imagine if your child, right, your treasured child, 5 to 11, gets COVID, the risk of myocarditis depends which study you quote. There's one study that quotes 450 cases of myocarditis per million. A study quoted by Paul Offit, Professor Paul Offit is my mentor, a mentor for all of us pediatricians in vaccinology. He's in Philadelphia. He quotes a figure of 1 in 45 who gets COVID gets myocarditis. OMG. Now, if your child gets MISC, as was brilliantly exposed and explained by Fong and Anis, the risk of you getting myocarditis is 50 to 75%. So parents, friends, we've got local data. Our NPRA has also shown that the vaccine is also very, very safe, very, very reassuring. Up until 18 February of this year, they have used 380,000 doses. There were only 37 non-serious adverse effects. There was only 1 serious adverse effect. The child was admitted and was discharged well. And the main AEFI that was reported was acute stress response, crying +++, fever, rash, and difficulty breathing. So parents, at the end of the day, it is about choices. And it is not zero risk choices. No. Myocarditis with the vaccine, 1 per million. Myocarditis with COVID, 450 per billion, or 1 in 45, according to Prof. Offit's quoted study. If your child get MISC, 50 to 75% will get myocarditis. So clearly, in my mind, the choice is to get a vaccine, which is the lesser risk. Yes, though.
I'm muted. Okay, sorry. There are a lot of questions now. One of them is, there's a question that says, is it true that the vaccines damage the reproductive organs of children and the long-term effects on the development and all that? I think, Musa, you want to tackle that first?
This is another myth, another fake news, right? I think it's extremely important that we look at good data, good evidence. Certainty is not overruled by doubt or suspicion. That is what we in medicine always practice, i.e. evidence-based medicine. Because they were saying that the antibody produced, right, recognizes the placenta protein, right, and damages it and causes miscarriages. But there's no such protein in the placenta. It is not true. For the heart, yes. This is what we call molecular mimicry or autoimmune. The antibody recognizes the spike protein, very similar as the heart muscle. That's why it causes autoimmunity or myocardial damage, right? Myocarditis, right? And it is the shortest and only form of autoimmune response, yeah? Because after 2 to 7 days, the child is well, just with rest, maybe with some NSAID. So the latest evidence is that it does not cause miscarriages. If it does, can you imagine all the mothers who've had COVID? They would have millions of miscarriages. Yeah, in Malaysia alone, we've had 3.5 3 million cases, and if half of them were women, can you imagine? Yeah. So, and it does not, it may causes changes in your periods, but most of them return to normal after a period of a few weeks. So it does not affect fertility, period.
Okay, all right. So that answers that question about the side effects. And now there's one here, which is mRNA is fairly recent and new, right? Slight effects mentioned were those of immediate after the vaccinations, but is there any study or projections or any long-term effects? And would there be any likelihood of anything surfacing later in life? I think Musa and Amar, if you would like to answer that, or if Dr. Fong want to put in, you can put in as well. Musa, you want to have a go first?
Yeah, okay. Now, it may be new technology to most of you, but to those of us in the discipline, this is not new technology. Messenger RNA was discovered in 1960, and the envelope, right, that nanoparticle to cover it and to administer it to the body in 1970. We've got 9 mRNA vaccines in the pipeline. Flu, rabies, cytomegalovirus, chickenpox, RSV. RSV now is filling our wards with bronchiolitis. Metapneumovirus, Zika virus, Nipah virus, and the latest candidate is the HIV mRNA virus. And not only that, we've got latest mRNA therapeutics to correct disorders of autoimmunity, cancers, and inborn errors of metabolism like PKU, phenylketonuria, and glycogen storage disease. Now, let us be very clear. The final common pathway in mRNA technology is not novel, it's not new. It's just like the hepatitis B, the HPV vaccine, the cervical cancer vaccine, and flu, i.e. it presents a subunit protein of the virus. So it's not much different from the vaccines that we have now. What is novel is the strategy of delivering it, right? It uses the mRNA. It uses the nanoparticle, the envelopes of mRNA, it goes in the cytoplasm, does not enter the nucleus, so it does not damage your genetics. And then the mRNA sits on the ribosome, makes the spike protein. Spike protein goes into the blood, right, and stimulate or elicits antibodies that protects you. Yeah, not just neutralizing antibodies, but also CD4, CD8, T cells, and B cells, which is important for long-term memory. And if you look at all the adverse effects of mRNA, it is usually within the first 6 to 8 weeks. Myocarditis, 2 to 7 days. Blood clots with your viral vectors is 1 week. There is no vaccine that has got a long-term, rare, severe effect after 2 months. So this is a malicious perception about vaccines. There is no AEFI after 2 months. I give you an example. Polio. Polio after the oral polio vaccine occurs within 1 to 4 weeks. Interception, the telescoping of the gut after rotavirus occurs after 1 to 2 weeks. Thrombocytopenia after MMR occurs after 2 to 3 weeks. So it all occurs within 6 to 8 weeks. So that is why the CDC and the WHO insist that all manufacturers must do at least 2 months to ensure that there are no adverse effects. But you see, you remember the mRNA myocarditis? You didn't find it in the trials, not because it was rare and not because it was long-term. No, it occurred within the first 4 to 7 days, but because it was 1 in a million. That's why you need large studies. That's why They did 8.7 million doses and then they got 11 cases. Not because it is a long-term adverse effect, not because it is rare, extremely rare, yeah, not because it's chronic. So there's this idea of long-term is misleading. Yeah, Zul.
All right, thank you very much.
Can I add something, Zul, to that? 3 points. First, I want to amplify what Musa said. If you're going to see side effects, you're going to see them within 2 months. And so I think we shouldn't, have this kind of perception that it's going to continue. But secondly, we are forgetting that we have been vaccinating the world for more than a year now, millions and billions of people. If you want to see those side effects, if you talk about long-term, we should start seeing them, but we're not seeing them. So the long-term follow-up of people who have been vaccinated doesn't show any of these side effects. And that's very important real-world data of not just 30, 40 people, 1,000 people in a trial, but billions of people all over the world, including many of those who are listening in to this talk. But thirdly, I want to say something that people don't really know. We've talked about long COVID, but there are also long-term impacts of COVID. This is different from long COVID. I'm taking an example from Spanish flu, which happened early 1900s. People talk about how Spanish flu had very significant long-term impacts to increase disability in the community, to increase CNS damage, to increase Alzheimer's disease in particular. And there is concern that COVID infection will do the same. So if you want to talk about long-term impacts, I think you think about long-term impacts of the COVID infection rather than the virus, rather than the vaccine. I'm more worried about that happening, which is why it's not a wise thing to get infected, which many people talk about, that it's okay to get infected. No, it's not a wise thing at all. Back to you, Zul.
Okay, thank you. There are a few questions here which says that which ask about children who have been infected with COVID. So how long after the infection should the child get the vaccine? We know the guidelines from the Ministry of Health and all that, but I think Dr. Musa, maybe you have a different opinion, or Dr. Fong, if you could answer this on behalf of the Ministry of Health.
After the child has got a COVID infection, okay, if the child is back to normal and he's well, okay, and he's no longer infectious, actually the child can get the vaccine. It's not contraindicated after they have they've been officially off quarantine. They are well back to clinically to their previous self. Of course, if the parents are still having some concern, they can wait for a few weeks and watch whether their child's health is in any way affected by the COVID. Okay, if they are worried about MISC or MISC, developing in that child. So I personally, I would advise, given the community spread is so high currently in the country, I would advise the parents to get the child vaccinated soon after the child is off quarantine.
So can I just add?
Yes, please.
Yeah, previously it was 3 months. Yeah. Now, in my personal opinion, I agree with Fong that it's once the child is stable, i.e., about 2 weeks. But see, some of my colleagues are very hesitant because 2 to 6 weeks after COVID, 2 to 6 weeks after your COVID, you are at risk for MISC. Nanti those who are not keen about vaccine might say, kan vaksin menyebabkan MISC, tetapi kita tahu bahawa vaksin mengurangkan risiko MISC 91%. It reduces the risk of MISC in kids 12 to 16 years old by 91% compared to one who got COVID. Plus, the reason why we are advising is because if you're post-COVID and you get a second dose of an Pfizer vaccine, it induces what you call hybrid immunity. It is 50 to 100 times better than 2 shots of vaccine. This has been proven in 5 to 6 studies, and in fact, it's been shown that you kena COVID, 1 Pfizer vaccine, it is as good as 3 shots. This 6 studies has actually shown this because it reduces reinfection or breakthrough infections by 56 to 82%. Amazing, If you got three Pfizer, your breakthrough infection is still 50%, So I'm not saying that you want to get COVID. No, I'm just saying that the data shows prior COVID, you bagi the vaccine, you're as good as 3 shots. Unfortunately, the CDC and the Ministry of Health do not yet recognize this fact. Yeah, and imagine if we can do without a second Pfizer vaccine, what does it mean? 1, the child will be similarly protected. Yeah. 2, you save vaccines, right? 3, you have less risk of myocarditis or adverse effects, which freaks out our parents because usually the risk of the myocarditis is with the second Pfizer vaccine. Yes, sir.
So can I add one more point that parents may not be aware of, even our professionals may not be aware of? Children get reinfected. If you had a previous COVID, you can get reinfected. If you look at the UK data, just looking at Independent Stage, just released their data 2 days ago, a large number of children got reinfected within 3 months of their previous infection. So I think it would be prudent to get your vaccination early rather than waiting till later for the reasons that Musa and Fong have mentioned. Thank you. Back to you.
Dr. Zul, can I mention something about this? Because actually what Dr. Musa was saying was true. I've had patients that came in who had possible MISC during the post-vaccine. But like what Dr. Musa has mentioned just now, that the cause of illness, or maybe I speak in bahasa, the penyakit MISC ni, kalau dijangkiti oleh COVID-19 yang daripada awal tu, keadaan dia sangat-sangat teruk dan sangat-sangat tenat. Macam yang Datuk Musa kata, dia menyerang jantung tu kepada kanak-kanak ni sehinggakan jantung tu boleh berhenti dan menyebabkan dia mendapat banyak degupan yang tak baik lah, yang tak bagus, dan menyebabkan dia punya tekanan darah rendah dan boleh menyebabkan kematian. Jadi bila kita ada vaksin, dan saya dah tengok kanak-kanak yang dah ada vaksin dan dia dapat lebih kurang macam MISC juga, tapi dia jantung dia tu tidak seteruk yang berlaku kalau dia dapat MISC disebabkan oleh COVID infection. Jadi mungkin saya boleh sarankan kat sini lah, macam yang Dr. Amar pun bagi tahu tadi, dia boleh dapat infection yang 2 kali atau 3 kali COVID-19 ni, tapi kadar teruknya penyakit itu tak sama seperti yang kalau dia dapat vaksin. Dapat vaksin tu dia kurang sikit dari segi teruknya tu. Sebabkan saya bekerja di ICU, jadi saya dapat melihat spektrum ni untuk kanak-kanak yang tahun lepas yang tidak mendapat vaksin dan kanak-kanak yang mula sekarang ni yang kami dah nampak dia mula masuk ke dalam hospital dan mula masuk ke ICU, dan saya perasan yang bila saya bagi rawatan tu tidak seteruk tahun lepas. Dan ni kanak-kanak yang mungkin dah dapat first dose vaksin tu.
Terima kasih Anis tu jawapan dia ya berkenaan dengan MISC dan juga there is ada juga yang dalam chat ni yang mengatakan kita patut guna cakap dalam bahasa Malaysia kita kalau ada soalan dalam bahasa Melayu kami akan jawab dalam bahasa Malaysia, tetapi kalau dalam bahasa Inggeris tu kita jawab dalam bahasa Inggeris ya. Kita cuba buat dua-dua bahasa. Now the next question that parents often ask is children who have had Kawasaki disease, children who have congenital heart disease, especially cyanotic heart diseases, children who have developmental delay and autism, and children with cerebral palsy. Can these children get the vaccine or can they not get the vaccine? Amar, you try it.
Yeah, I think that it's very important for these children to get vaccine. Any child who is disabled, especially disabled physically with a muscular problem or cerebral palsy, any child who is immune compromised in particular, and any child with a chronic illness, whether it's a heart disease or diabetes or other chronic illness, these are the children who are more likely to get a severe COVID infection when they get it, more likely to die from a COVID infection. 70% of all children in Malaysia who have died have died with a comorbidity. So I believe that these are children that we should target. Right now, if any parents are listening, if you're hesitant, if you have a child with a chronic illness, a child with a disability, or a child who's immune compromised, please come forward for the vaccination earlier than the other children because your risk is higher. Back to you,
I think obesity is also one more thing that they should take into account, and then diabetes, kids with diabetes. Ada soalan di sini ya. Saya mohon pandangan ini. This is specific to this condition, alright? Allergies. Saya mohon pandangan panel mengenai anak-anak yang ada asma dan eczema. Adakah sebarang kesan yang severe kepada anak tersebut sekiranya divaksin? Musa?
Yeah, thanks a lot. Kontraindikasi yang absolute daripada vaksin Pfizer adalah kalau anda pernah mengalami anaphylaxis. Bila kena injection tu, you pengsan, tekanan darah turun, tak sedar diri, ya, dan memerlukan CPR. Atau anak anda alah kepada nanopartikel, ya, yang menjadi envelope untuk MRNA itu. Ini dibuat daripada PEG, polyethylene glycol, ataupun polysorbate. Kadang-kadang terdapat di dalam cosmetics yang Dr. Fong dengan Dr. Anis pakai, atau dalam makanan, dalam emulsifiers. Ya? Kalau tak ada, insya-Allah, alahan, eczema, lelah sebagaimana Dr. Amar kata tadi, satu indikasi untuk awal dapat vaksin. Alah makanan, alah kena gigit oleh serangga, ya, bukan merupakan kontraindikasi untuk mendapatkan vaksin. Jadi jawapan pendeknya, lelah dan eczema bukan penghalang untuk mendapat vaksin, malahan seperti yang dikatakan, diperingatkan oleh Dr. Amar tadi, lebih penting untuk anda mula-mula cepat-cepat mendapatkan vaksin. Sebab COVID ini dia banyak melibatkan jantung dengan saluran pernafasan, dan yang MISC itu memerlukan rawatan di dalam ICU dengan respirator, alat bantu bernafas. Ya, Zul.
Alright, there is a question here that you know that people have got a lot of preference for Sinovac vaccine. So there's a question for parents as well as a pediatrician here. They're all waiting for the Sinovac vaccine. And can we know when the government will approve Sinovac for children? That's one. And then number two is, should these parents wait for Sinovac to come while, you know, and expose their children to COVID in the meantime? Dr. Fong, would you like to try that? Followed by Dr. Musa. I'm sure Dr. Musa has a lot to say about this.
Okay, first of all, I think the only vaccine that is approved for children right now in Malaysia is the Pfizer vaccine. And Sinovac is not approved yet. It's only approved for adults. I think we must get that clear. Why is it not approved yet for children in Malaysia? Is because Sinovac has not, CoronaVac, the company has not come up with adequate data to convince our KKM to approve the vaccine. A lot of the study is still ongoing. I myself is involved in one of the study, so we are still evaluating, the efficacy of the vaccine, and all those things is still an ongoing trial. So given that, I think we should wait for more data to come before the government approve the vaccine. We need to know for certainty it is efficacious for children, rather than just giving it just because it's effective for adult. Okay, so I think we should wait. And the other thing is, I think it's not wise to wait for Sinovac to be approved, right now, because I think there's an urgency now. There's so many children coming down with Omicron, and there's increased hospitalisation, and I say increased risk of MISC and all the other adverse effect of COVID. So I think it's not advisable to wait. We should go ahead and for the Pfizer vaccine, if later on there are more evidence come up for Sinovac, then we can evaluate that again. Yeah, thank you. Yeah.
Sir?
Yeah. We have very good studies in Malaysia. The RECOVAM data showed that there is clear waning, drop of both Pfizer and especially Sinovac effectiveness, yeah, with time, right? The Pfizer efficacy was 89%, right? 89%, good, just like what the trial said, isn't it? 95%. After 3 to 5 months, it dropped to 68%. Still okay. Look at the Sinovac vaccine efficacy. When they first used it, and that's about 35 million, 35% of our population. I think Pfizer was about 45, I think. Right? The vaccine efficacy at onset was 76%. What was Pfizer's? 89%. But after 3 to 5 months, it had dropped to 28%. So parents, it's quite clear, isn't it? Right? If you opt for Sinovac, you are basically opting for a vaccine whose efficacy is very, very low after 3 to 5 months when compared with Pfizer, which has been licensed under EUA for our children 5 to 11. I'm sure you don't want to give your child a second best vaccine. Wallahu alam.
Okay, thank you very much. Here's a question for Dr. Anis. Yeah? Please explain the health background of the children you mentioned with neurological and MISC issues. Do they have underlying issues like asthma? So do they have comorbidities basically?
Okay, so for children with MISC, we've seen two types of children that comes in with MISC. One are the healthy children and the other one with comorbid. So both actually has, both groups has increased risk of getting MISC by natural COVID infection. Usually they come in different presentation. They can come with Kawasaki-like illness, like they can have rashes, red eyes, and then they can have like a strawberry tongue and then strawberry lips, very red lips. They could also come in with chest pain. So like I mentioned just now, there are children whose older age group, probably about 10 years old, 11 years old, they can actually tell you that they have chest pain. So that's when we caught the problems with the heart, which in MIC, the main organ that's usually affected is the heart. And the other group, they can come in with seizures. So they can come with encephalopathy, what we call it, like when the children doesn't behave as what they used to, and then they start to talk differently, and they start to behave differently. So then that being translated to probably infection that's going on inside the brain, and all this inflammation induced by the natural COVID infection, because it follows, it recognizes a similar cell that's in all these organs, and some of them come is just vomiting and diarrhea. So those are the ones who actually presented to us.
Ada satu soalan ni very specific ya. Adakah perlu vaksinkan anak secepat mungkin sekiranya anak telah dijangkiti COVID-19 dalam tempoh yang terdekat? Tadi kita dah jawab dah ya. Anak ni perlu diberi vaksin juga apabila anak tu dah baik daripada jangkitan, selalunya dalam 2 minggu ya. So we don't have to answer that. Now if a child has had cancer previously and currently the cancer is dormant, is it safe for the child to be vaccinated? Would the COVID-19 vaccine trigger the cancer again? Is there any information on this, any data on this? Musa?
Ini Amar is the expert lah.
Okay, Amar.
Zul, I've not read any data that suggests that COVID vaccines can trigger or stimulate cancer. I want to say that if you've had cancer and you're still on treatment you may not respond that well to the COVID vaccine. You may have lingering immune deficiency. So it is important that you get vaccinated. If you've had a cancer, you are more susceptible to getting severe COVID and dying from it. I would vaccinate you. You probably will need a booster as well. I think even if you're a child, I think I would recommend after 2 primary doses, perhaps you will need a booster as well, because we think your immunity and your immune response may not be so good. I would also say that such a child is the one that I want to protect from the current Omicron wave. Back to you, Zul.
Thank you.
Zul, for a moment, could I show one slide?
Sure.
I just want to show a slide to what's happening in our country right now, and I'm showing it. And I don't know if you can see this slide, everyone. This is COVID data in Malaysia. And can you see that our Omicron wave is much larger than the Delta wave? And we're talking children here as well, only children. Huh? The red dots are the 7-day average for children aged 5 to 11. The blue dots are children aged 0 to 4, and the green dots are children aged 12 to 17. So it's very important that we vaccinate our children right now, because there's a huge rise. Why is there a drop at the end? Because of school holidays. Once school holidays is over, this curve will start to go back up again. Back to you, Zul.
Thank you. Here's a very specific question, all right? 7-year-old girl with a history of acute ITP, all right? In 2018 and treated with IVIG, and a history of febrile seizure in 2016. So is it recommended for her to take the vaccine? And please explain in specifically related to ITP. Anybody want to take this?
I suggest that you download the guidelines from our Hematological Association written together with Ministry of Health. They're very clear about this. They recommend you get vaccinated. Now, if you had your immunoglobulins just recently, they might damage your vaccination. But this one sounds like your immunoglobulins, quite some time ago, and they probably have washed out of the system. So there is no danger of vaccination, and we would recommend that somebody with ITP get the vaccination. If you still got low platelets, please tell your doctor about this, and they will make sure that they press the vaccine site for a longer period to prevent any small bleed at that area.
Yeah. Okay, so basically, just to answer all these questions that are coming in now, if your child has got any comorbidity, any illness at all, they should actually be getting the vaccine, because if they get COVID, they will suffer a lot more than a child who's got none of these comorbidities. There are a few questions here where the children will be turning 5 this year. Some in August, some in October, some in November. Basically, they have not really reached 5 yet. So can they receive the vaccine? Anybody wants to try this?
I think the guidelines for vaccination is very clear. You can only receive the vaccine once you turn 5 and above. So if you have not turned 5, you have to wait, okay? Because there's no study for children less than 5 that has come out to show that what kind of dose that we should give to this group of children.
Yes, Musa, I know you're itching to answer that question.
I know lah. You must get it official from the Ministry of Health, and that's why Fong is here, But yes, I totally agree with her. But actually, there are studies being done from kids 6 months to 5 years old. They are using 3 micrograms. Yeah, 3 micrograms. That's 1/10 of the remaja punya dose atau adult punya dose. But they found that when they use 2 doses, they were not getting the vaccine efficacy. Yeah, we use 1/3 dose, we got 91% vaccine efficacy in 5 to 11. So when they drop it, you see, this is responsible trials, making sure that you use the least dose enough to elicit an antibody response. But they found that 2 doses was not enough. You may require a 3rd dose. By the way, the scientists, when they first came out with the vaccine it was Moderna in March 2020. The Chinese informed the genomic sequence in January 2020. You see, within 2 months, amazing, 2 months, they got the vaccine. Right? From that, they already said that we need 3 doses. The scientists are very clear. Unfortunately, the word got around that it's 2, the 3rd one is a booster. Scientists are very clear. That's why we, myself, and all of you have got 3 doses. This is actually the primary series. Yeah, and I hope there will be a vaccine soon for our 6 months to 5 years old, because they are now unprotected. And you saw Omar's data. It is frightening. Can you imagine? At its lowest, the hospitalization for 5 to 11 was 0.1 per 100,000. That was epidemiology week 2 of the year. And 4 weeks later, it's gone to 0.5 per 100,000. That's a 5-fold increase. Yeah, our adults were just 2-fold increase. Yeah, but 5 to 11, boom. And as Anis and Fong amplified, 5 to 11 are the highest at risk for MISC. Yeah, 100 out of their 173 patients, what, 58%? So please, consider the vaccine very seriously. Yeah, Zo.
Okay, thank you very much. There's a question here for an MO from in KKM, right? And many parents have actually asked him this, just like many have asked us as well, if there is an option of non-messenger RNA COVID-19 vaccine for children in the near future. I think we've already dealt with that. I mean, Dr. Musa has already mentioned about the Sinovac vaccine. And then, any of you like to add on to this?
I think work is going on. There's also Novavax and other vaccines that people are producing. I think we need to follow the data. The problem is waiting. How long can we wait? When you have a massive Omicron wave, do you want to wait for another vaccine? I would not wait if I had a child. So I think we should follow the data, but right now we need to protect our children. So there are other vaccines being trialed right now.
So,
yes.
Another interesting thing is some of our colleagues are saying, why are we stretching it to 8 weeks? We've got Omicron. We should actually shorten the duration so that we can get more of our kids immunized. Okay, my answer to them is this. One, supply. Do you have enough? 3 weeks, 8 weeks, Ministry of Health can source more vaccines. Number 2, 8 weeks, you're past the MISC period, 2 to 6 weeks, so that those who are anti-vaccine cannot say, vaccine menyebabkan MISC. Number 3, it has been shown that when you widen the space between the 2 doses, your vaccine accuracy is much higher. That's why Moderna is showing better results than Pfizer, because they do it 4 weeks later. 8 weeks, even better. Yeah, and the CDC just about a few days showed that it is confirmed that it is more efficacious. And my 5 final reasons is this. As I mentioned to you, I think about 1 million of our kids already got COVID. So they've got COVID. So when you give a first dose of a Pfizer vaccine, you get hybrid immunity. Not only you get high levels of neutralizing antibodies, but 50 to 100 times better than 2 vaccine shots, You also get CD4, CD8, T cell, and beta cell. These are long-term memory cell that sits in your bone marrow and your lymph glands, So long-term protection. So and you can check alias Eric Topol. He showed the 6 studies that prior COVID plus 1 dose Pfizer, it is good as 3 Pfizer shots. Yeah, Zo.
Okay, so the catchphrase here is hybrid immunity. All right, that's a new one. Okay, now this is another question here, whether the COVID vaccine is suitable for special needs children. I think we've answered that. It is actually essential for special needs children and children with comorbidities to actually get the vaccine. And then And then there's also a question about Kawasaki disease, whether they can take the vaccine. Yes, this has been answered already. They can take the vaccine. And okay, now we've got, there's a question about a 1.5, somebody has got a 1.5-year-old toddler. Is it safe to vaccinate? No, it's not, because it is now 5 years to 5 years and above only. And then, all right, now this one, okay, this is one that's something more pertinent. Can the panelists advise on the do's and don'ts after the child gets vaccinated? Anybody, maybe Amma would want to take that up.
Let's say before the vaccination, let's start there. I think the day before the vaccination, take it easy. Don't stress out, don't over-exercise, get good sleep, and don't use any medication extra. Your normal medication is fine, but don't use some Panadol, paracetamol, or aspirin or anything before. Okay. When you come for the vaccination, of course, it's good to bring something along for your child to comfort them in case your child is, afraid. And I think it's good that one or both parents accompany the child. After that, it's very important for the next 7 days not to overexert. Don't go for a jog, don't go for a swim, don't do exercise. This is as a means to reduce your myocarditis damage if anything happens to you. Apart from that, it's the usual kind of advice, which means give your child, some extra care at this time, because they may be a bit, cranky after the dose. They maybe have a bit of fever, a bit of pain. You're welcome to use some paracetamol at that time to bring the fever down. I think you should also monitor them. If you look at the Ministry of Health guidelines, which you can find on their COVID web page, on the last page of their guidelines, they will tell you the signs and symptoms you should watch out for myocarditis. I think all parents should be aware of this and watch out for those signs. If you see them, you should go and see a pediatrician and ask for their advice whether you should get any tests done. So I think those are some of the do's and don'ts I would suggest to you. I'm not sure whether my colleagues have other suggestions as well.
Just to add the last bit to Amar, excellent Amar. If your child complains of excessive coughing, difficulty breathing, mommy got pain in the chest, yeah, I have difficulty breathing, please bring your child to see your family doctor or pediatrician. They might want to do some tests, yeah, to make sure that it is not myocarditis. But reassure the parents that if they do have myocarditis, it's usually 4 to 7 days, and usually with the second dose, and most of them get better within a space of 2 to 7 days. Some of them may stay in hospital for 1 or 2 days, but most of them recover completely. Thanks, Amar.
Okay. And Dr. Fong, that's a question here. Why are children more asymptomatic versus adults? Does this mean they fight the virus better than adults? And on long COVID, even though with small incidents, do they have health issues?
Okay, generally, like I mentioned before, children are less symptomatic compared to adults. As to why they are less symptomatic, I must say, I am not sure exactly why, but perhaps it has something to do with whether it's innate or adaptive immunity. Because children generally have stronger innate immunity compared to adults. Adult has better adaptive immunity, and also the fact that adult has more ACE receptor. So and also with COVID-19 virus, they actually attach to the ACE receptor that is found in the lung, in the heart, and all those things. So in children, generally ACE receptor is not as numerous as in adult, so they got less symptoms. Generally, so even though they are infected, they may not show the symptoms, so you are not aware. If you don't test them, you do not know they have come down with COVID-19. Okay, I think what was the second question, Azul? About
the second question was regarding, I think it was about long COVID, I think.
long COVID, I did mention that long COVID is not that common in children. Even in the study done in the Western country, in Finland, for example, they only found 2% among their children compared to adult, which is about close to 40-50%. In UK, the percentage of long COVID is higher, 7 to 8%, or in some studies even quoted more than 10%, you know. So, but over here I'm not sure whether it's a cultural thing or whether it's a genetic thing, but somehow we see much less long COVID, no? When we follow up our children with stage 4 and 5, when we actually ask direct questioning, you know, about these symptoms, they don't seem to come down with a lot of them with long COVID. A small number of our follow-up, maybe 1 or 2 will have some sign or symptoms of long COVID, but not the majority of them. Huh?
So I'd like to add
sorry, Amma.
Thanks, Musa. I'd like to add a comment to the first part of the question. There's a paper out from Imperial College London in early part of this month showing that for children under 10, the risk of hospitalization with Delta or with Omicron is the same. That children don't, are not necessarily milder with Omicron compared to adults. Adults seem to have a milder, not mild, just a milder infection with Omicron, but children under 10, that's not true. So I think we need to be a bit careful. There's definitely a very large number of admissions in the UK right now with Omicron for children, and we are starting to see that in our country as well. So this variant seems to hit children more. I also want to caution us that, you know, variants change. The disease is changing. Who knows, in the future we don't get a variant that is actually targeting children more than it targets adults, as we are starting to see now. Back to you, Musa.
So there is actually a meta-analysis of 14 trials, yeah, in the PIDJ, Pediatric Infectious Diseases Journal on long COVID, and the prevalence was anything between 4 to 66%. But there were only 5 studies which had a control, so you can compare. And the largest study was from the UK, the CLOCK study, right, from University College London and Public Health England. They showed that 1 in 7, i.e. 14%, had 3 symptoms after 12 weeks. Yeah, and 1 in 10 had 5 symptoms after 12 weeks. So that's 14%. That's very high with a control. Yeah, yeah. So I think we may not be detecting it or recognizing it, or as Fong said, it may be cultural. We accept our children who have brain fog as being biasa, who have slow learning, acceptable because it is the pandemic. Many of them actually have headaches. Many of them have difficulty with breathing. Yeah. So I think learning is a major issue, but sometimes you can't differentiate it between the pandemic, the lockdown, missing losing your dad, your siblings, your uncles, your aunties, and long COVID itself. But yeah, we need better studies in children, but the numbers in adults is worrying, very, very worrying. Yeah, from the especially heart diseases. It's just way up. And so in the UK, the kids, they have about 30,000, 20,000, 5 to 11, and more in the older ones, about 30,000. They're about 50,000, and with the Omicron wave that Amar just mentioned, they are faced with more. And they've put aside, the US has put aside $1 billion USD to look into long COVID. I hope MOH, Dr. Fong, does similarly.
Musa, I was just looking at data from Independent Sage UK, came out 2 days ago, and the current official number of long COVID in children is 107,000. Okay, yep. So I think the numbers are huge. Of course, not all of that persists forever, and some of them recover. But agree with you. Is parents describing children who cannot go back to school, cannot go back to play, cannot go back to do the things they were doing before, change personality, and I think it's worrying many of us.
Thank you. There are a few questions here asking about the children who have congenital heart disease. Here, one is about an atrial septal defect, and the other one ventricular septal defect, and asking whether it is safe to take it. The answer is yes, they should be taking it. And the second answer is some say that Sinovac is safer in the long run than mRNA version vaccine, as there are insufficient data on long-term effect on children. I think we've already answered that. And I think Dr. Musa has already given the answer earlier on. So there's no worry about giving the vaccine now to those above 5 years old, and they're giving the 10 microgram in 2 meals, which is a smaller dose than they give to the adolescents and the adults. And so far, the side effects have been very not as much as in adults. There's also a question here: side effects of vaccination in toddlers. As we know, toddlers haven't been given it yet, although there are reports in the newspapers about China giving it, but it's a Sinovac and Sinopharm vaccines, but we don't have any data. And okay, and the other one is 𝐒𝐔𝐃𝐀 will consider Sinovac vaccine for kid vaccination? Is there any scientific data that Sinovac had less side effect risk compared to messenger RNA vaccine? I think Dr. Musa has already mentioned that earlier on about the efficacy of it, but he didn't touch on the side effects. So Musa, do you want to sort of talk about side effects? Because I know that Sinovac, the only data that we've got is the phase 1, phase 2 trials. Do you know of any other later ones?
Dr. Amal, answer.
You know, I wish there was more data on Sinovac. We want that data. Look at China, they've given hundreds of millions of doses in children. Indonesia has done the same as well, but they don't seem to share the data with us. We want to see that data. I think some of the best data for Sinovac is now coming from Malaysia, because we've been collecting data and trying to show that data to us. So there's also some data coming up from Hong Kong, but mainly for adults rather than for children. So I'm a bit blurred as to the side effects of Sinovac in children. You know, I don't see the data. As Zul clearly pointed out, we do not have published phase 3 trials for Sinovac for children. We want to see those phase 3 trials, which is why in Malaysia we're embarking on one, and Fong told you that she's involved in that trial. So I think we need good data. We are pediatricians. We're not going to use a medication or a vaccine on your child without good safety data, both that it works, number one, and two, that, you know, this is safe, not just that it's efficacy, but it's safe. So I think that a lot of push to get Sinovac. We are not vaccine company people. We don't earn money from any of them. We'll just use the best vaccine and recommend to you the best vaccine. I must say, the amount of data and studies on Pfizer is phenomenal. Never have I seen a vaccine ever produced has that much number of studies done on it, both on its safety profile and efficacy, which is why Ministry of Health recommended Pfizer to you for your children. So we want more data for Sinovac. Right now, there's a poverty of data in children. For that reason, we cannot recommend it to you at the present moment.
Yes. Okay, so I hope that answers the question. All right, now there's one here. According to American doctors working with vaccines, say that the vaccine can cause irreversible effects on the brain. Would anybody like to elaborate on this?
We are very sure that COVID can cause irreversible damage to your brain. That one we're very sure. And it's not uncommon, you know, to have that. It's not just long COVID talking about, but I think long-term, as I suggested, you're going to get a higher risk of early onset dementia and other CNS problems that are going to be an epidemic that we're going to see 15 to 20 years from now. I have not seen any clear published data of any magnitude that the vaccine caused CNS damage. I know some people have alleged this, but we are data-based, science-based people. Please show us good studies on this, and I'd be happy to read them.
Okay,
so about COVID-19 affecting the brain. So we have seen children coming in with COVID-19 and they have inflammation in the brain and they have bleeding, and sometimes they have a lot of infarct. So they end up being hemiparesis, you know. they have the loss of paralysis of the limbs and all that. And some of them have a lot of seizure and all those things. So it's actually a very serious sequelae from COVID-19. Yeah.
Yeah. So I think what we need to emphasize here is that the disease actually causes all these problems rather than the vaccine. Musa, did you want to say something, Musa?
Just very shortly, this idea about brain damage due to the vaccine actually gained currency amongst the anti-vaxxers, because the person who made the noise was the founder of the virus in human immunodeficiency virus, HIV, Montaner from France, and that's why it gained currency, and he has not provided any data at all, as emphasized by Amar.
This is a question for you, Amar. Well, I think it's for you. I think you're the most qualified to answer. The question is, I wonder, with teachers refusing vaccination and many school cluster, is it still feasible to have physical schooling? In addition, many children get infection and their teacher despite abiding by the SOP. So what are the recommendations from you?
Thank you, Zul. Now, this is very difficult. I've been asked this by many media and by parents and by schools, and there are no real easy answers to send children back safely to school. But we do want to do that. Why? Because we are worried about the impact, mental health pandemic on our children, the impact of the loss of education on our children's future. So in terms of sending children safely to school, firstly, vaccinate your children. That's one tool, but that's not the only tool. Other tools that you want, I think the second most important tool is change the quality of your mask, improve the filtration and the fit of your mask. I would move away from surgical masks and move to a KF94 mask for my child, even for myself as an adult. And again, please buy a reliable KF94 mask. There are a lot of fake ones. I would say easily that 50% of the ones advertised online are fake. So buy from a reliable manufacturer a KF94 mask. Having said that, there are poor families. I think we should work together as a Malaysian community, as a parent-teacher association, as schools, to buy these kind of masks for children who come from poorer families. So first, vaccinate. Second, I think use a better quality mask. Thirdly, please improve the ventilation in every classroom. I especially worry about those that are closed up, that are air-conditioned, those with international schools and stuff like that. But if you're open classroom, you're a lot better. Even then, there are three strategies you could do. One is increase the delivery of fresh air coming in, that's ventilation. Secondly, filter the virus out of the air, that's using a HEPA filter. And thirdly, consider looking at the data for sterilization, which is UV technology. That's a very new technology. You need to look at the data on its safety. So the third step is to actually improve the ventilation in each classroom. The fourth one, I would say, is be a bit more liberal in doing COVID antigen testing. I think it is a valuable test. The slightest illness in a child, we should test. We should test it at home before we let the child come to school. Of course, these tests are operator dependent. You need to follow the guidelines correctly to get a good result. I wish we had more funding to supply schools with more of these tests so teachers could use them more liberally for children when they need that, again, for children who come from poor families. The next one I would say is to keep children in the classroom bubble. Don't mix them. Keep them in that classroom so that if one classroom gets infected, we don't have to shut down the whole school. Schooling can still go. The one I have difficulty with is what to do about makan. What to do about makan time? That's when you unmask. I would not eat in the class. 30, 40 kids in the class, all unmasking to eat is, I think, a crisis sure to get Omicron, which can spread quite far and wide, quite easily in the air. So I would say if you have to eat, you go and find a quiet spot somewhere in the class, in the school, and eat, and maybe you stagger the makan time. The other option is to shorten our school hours, give us a face-to-face. So don't eat at all, eat before you come, keep your mask right through, and then go home and eat. That's another option. The last and perhaps one of the most important things, which is still neglected, is a very good relationship between the teachers and the parents. I think there must be an open communication. You must tell parents immediately if one child in the class is infected so parents can take action for their own children. quite often this is just a vague message, somebody has been infected. I think that's not adequate right now. There's no stigma for getting COVID right now, I think, in the country. So we should say, the child sitting next to your child got infected, so please take adequate precautions. So teachers and parents need to work together, and teachers need support. It's not difficult, not easy at this time. I don't know how much support they get from MOE. I think it's for us as parents to get together to support our individual classroom teacher. Also, they might need some financial or equipment support at this time. Maybe we all buy them a HEPA filter for our class, for example. Back to you.
So can I just chip in? Actually, last year, myself, Amar, Prof. Adiba, our engineers and architects from University of Malaya, Tini, Hartini, Dr. Hartini, the Malaysian Pediatric Association came up with a document. It's only 10 pages, lots of infographics. And if I can summarize it in six areas. It's simpler than the 120-page guidelines from the Ministry of Health. Basically, it looks at safe at school, so you ensure healthy policies, right? Which means you have a COVID team in the school. They know exactly what to do when there is a case. Yeah, healthy buildings. The engineers they made beautiful drawings. How to make sure that the air is always fresh, it's always circulating. Where you put your fans. Yeah, and then healthy classrooms. All right. How you distribute the kids, how you maintain that class bubble, healthy schedules, right? How you make sure that you stagger your kids, yeah? Healthy activities, spend most of your time outside because the risk of COVID is 18 times less when you are out in the open. And finally, healthy, vaccinated teachers and students, as Amar has beautifully summarized. Thanks, Zo.
There is a question specifically for Dr. Musa, if I can find it. Okay, okay, thank you for sharing that currently there are no other symptoms using the messenger RNA vaccines. However, what are the potential symptoms in the next 5 to 30 years down the line?
Oh my goodness. I've been a pediatrician since the 1980s, as old as Zol and Amar now, and I have not seen an unknown, a chronic, a very rare adverse effect following immunization of vaccines that we have used in children. Whether it's the 5-in-1, the hepatitis B, the MMR, no, all of this adverse effects will appear within the first 2 months, right? The reason why we don't see it in the studies and we need to open it to the population is because it is extremely rare. But myocarditis appears within 7 days. Yeah, blood clots with the AZ vaccine appears within 2 weeks. So it is within 8 weeks of immunization. So there is no such thing. This is a malicious misunderstanding of vaccinology. All right? There is no, unless you can tell me there is a historical precedent, right? Encephalitis in yellow fever appears within 2 weeks, right? Guillain-Barré syndrome, the longest, appears within 8 weeks. By the way, if you get natural flu, that is a flu vaccine, it's 17 times the risk of getting Guillain-Barré syndrome, whereby your legs become weak and you cannot breathe. You need ventilation. 8 weeks. So within 8 weeks, that's why WHO and CDC says minimum 2 months, right? But of course, they also they mandate the drug companies to follow up for 2 months. And as Dr. Amar has shown, we've already used 10+ billion, not millions, billion vaccines. And they have not been what has been described as chronic, long-term, right? And all the vaccines that we used in the past have not shown adverse effects after 5-10 years. Okay, this is a Malay phenomenon. Why? Because in one of the programs in analysis, one guy from pharmacology said, there was this medicine that was used in the pregnant mother to prevent premature labor. It caused cancer 3 generations later. I said, hello, that's not a vaccine. That's still bistrol. That is a hormone. All right, that has really poisoned. And some groups like PPIM, Freedom of Choice, have gone around marketing this malignant thought. Yeah, Zul.
Yeah, okay, thank you. We have, okay, there are a few questions here about when the Sinovac vaccine will be approved and all that. Indonesia, Thailand, and China have taken Sinovac. Yes, it's true. Sinovac vaccine has been used in these countries. However, there have been no data, no phase 3 data, and no data on children that has come out from any of these countries. So we don't have the data. So without the data, we cannot give the vaccine until we are sure. It cannot be on assumption that it works, right? And then there's a question here, right? This is I think it is related to somebody who's got immunodeficiency. Is COVID-19 vaccine safe for a child with bad medical history? For example, a child who had a series of infections like sepsis, bronchopneumonia, atypical pneumonia, mycoplasma pneumonia, HFMD, chickenpox. Blood tests show high reading in white blood cells, monocytes, and neutrophils. What would the panelists suggest COVID-19 vaccination for children with this sort of medical history? This sounds like somebody who's got an immunodeficiency. So Amar, you know,
I think Fong is good to answer this question. Fong?
Okay. Yeah, we do have children with underlying immunodeficiency under our follow-up, and we actually encourage every single one of them to go for vaccination. We think it's very important for this group to be vaccinated because otherwise they may come down with severe COVID. So children, like Amar had mentioned, very high, children with comorbidity has very high risk of severe COVID. So please go for vaccination. Yeah.
So Fong, do they still go for 2 doses or you give them extra doses? Because the immune system won't be working so well. And for these sort of kids, we actually suggest a booster dose, right?
Yeah, for the adolescent, yes. But for the 5 to 11, that has not been endorsed yet. A booster dose for this group. Okay, but I think the data will come. Okay, people are doing study on this group as well. So definitely, I think there's a need for that. Because I say the primary series should be at least 3 doses. But like I say, at this moment we are still at the beginning of our first dose. Okay.
Yeah. Okay. All right. So, well, thank you very much. It's almost 4:30, and I think our time will be up at 4:30. But before we go, I'd like to ask for, some last words from all of you. Maybe we can start with Dr. Musa.
Hey, Dr. Anis lah.
Okay, Dr. Anis, start with the younger.
Okay, so if I can say something and to all the parents out there, komplikasi kepada jangkitan kuman COVID-19 dia membawa risiko yang berat, terutama dari segi kes teruk jangkitan kuman COVID kategori 4 dan 5 dan juga MISC. Dan kita sekarang dah ada data yang agak besar dan bagus untuk menunjukkan jika divaksin, risiko kes teruk dan MISC ni adalah sangat rendah. Kalau kita boleh elakkan jangkitan kuman ni dan kuatkan sistem imunisasi anak-anak kita, kalau terkena pun jangkitan kuman yang akan datang, yang sama ataupun varian yang lain atau Omicron terlebih daripada Omicron, dan insyaAllah risiko sakit tenat dan MISC ni akan menjadi sangat rendah.
Okay, thank you, Dr. Fong.
Yeah, I think before I go, I'd like to share a short story with everyone. This is about one of my unfortunate patients. And this patient not just only have COVID-19, she had myocarditis and she had MISC. And later on, a month later, she came in with a myocardial infarct, a heart attack. Okay, heart attack. And of course, we started the child on all the medication. And a week after we have discharged, actually the child's heart is very big after the myocardial infarct, heart attack. A child having a heart attack is something that we don't hear every day. And this is something that you can get from COVID. Okay, so I think these are all very serious adverse event that comes out from COVID. Okay, and I really urge all parents not to wait. Go ahead with the vaccination. Don't think too much. Don't overthink the issue. No, I think it's safe. It's a safe vaccine. Yeah, and I think everyone should go for it. Yeah, thank you. Yeah.
All right, Musa, 1 minute.
Dr. Zul,
Yes, Selva.
before the seafoods go, can I go on first?
Yes, of course, but you're not in the panelist.
Okay, never mind. Okay, fine.
Okay, please do.
No, just to, I mean, I've been following it. Sorry, sebelum tu, I'm just suggestion is that some of the questions not answered and some of Dr. Musa's explanation, maybe we can put it on the MPA public website actually, so that the public can access on that, especially Dr. Musa's 6 guidelines and the infographics, and also some of the questions actually. There was one question pertaining to nephrology. I mean, the parent answered 1 kidney. Let me tell you, all my patients on dialysis have received 2 doses, and the adolescent have received 3rd dose actually. As we are speaking, 2 of my patients just received a dose and coming in COVID category 4. And all transplant patients, pediatric transplant patients, before they go for transplant, we assure that they get the COVID-19 vaccine. It is important actually. And prednisolone can be given, no issue. As Dr. Amar said, IVIG, yes. If you have IVIG, we like to defer for a while before you get the vaccine. With that, thank you, and I'll leave it to the seafoods actually. Thank you. Bye.
Thank you. By the way, Dr. Selva is a pediatric nephrologist, so he answered the question for you. Where were we? I think it was Amar's turn, is it?
Or Musa. Musa, go ahead first.
We leave Musa last.
Thanks, Amar. I have a personal story, one good and one not so good. I have 6 grandkids. 3 of them are less than 5, so not eligible. 2 of my grandkids, 5 and 6, have got the vaccine. They came home, superhero. They were so excited and no issues with the vaccine. You know, these kids will be the best advocate to all the parents and other children to get the vaccine. Right? The not so good story is my eldest grandkid in Oman got COVID. He was very sick. His father was very sick. It's a good thing that my youngest grandkid, who's just 6 months, was spared of the COVID. Oh my goodness, it is heart-wrenching thinking of them in Oman, because it's not yet licensed under EUA for use in Oman. In fact, I was thinking I would fly him back from Oman to Malaysia, you know, because the Ministry of Health has been at the forefront of getting our kids with the vaccine. So please, parents, healthcare workers, please advocate for the vaccine. It prevents our kids from getting COVID, from getting long COVID, from getting MISC, from getting into the hospital, from getting into the ICU, and from dying from COVID, so that they can enjoy their school. All the lousy experience that Amar has mentioned about these kids don't know how to mix, socialize, and all that would be mitigated. So please consider seriously, from the bottom of our hearts, from the Malaysian Pediatric Association and from Immunize for Life. Thank you very much, sir.
Thank you. So, Amma, all yours.
Thank you, Zul. We're pediatricians. We are pediatricians because we care for children. We have no vested interest here in vaccination per se. We know the value of vaccines, so we talk to you about it. And we want to encourage you to vaccinate because we've seen the data. I want to say to parents and to medical colleagues who are listening in, please be discerning about data. We need to look at the whole data and science. Don't cherry pick. You know, there's so many WhatsApp and other messages. I get flooded by them. People ask me to evaluate this video or that WhatsApp. Most of them are data-less. There's no data to back the opinions there. So look at all the data, be discerning. See that there is so much data now that COVID is a nasty illness, even for children, and vaccinations help our children. So with that, we'd like you to consider vaccinating your children and yourself if you haven't done so. Thank you. Back to you, Zul.
Thank you, Emma. Before we go, I think we have now did the poll to show. So if we could have the slides of the polls, please, and then if the participants could answer. The first poll is, in your opinion, how serious is COVID-19 in 5 to 11-year-old children? Do you think they are mild? Do you think they are moderate? Or do you think they're potentially serious? Or do you think they are very serious? If you could just take a few seconds to just give your answer, then we will have a look at we will have a look at the results later. Unfortunately, we can't share it with you. So we'll give maybe about 10 seconds to answer. Okay, can we get the poll question number 2, please? Poll question number 2. Do we have the poll question, please? Secretariat. Okay. Poll question number 2. Will you get your children vaccinated against COVID-19? All right. If you've already had, if your child already had, you tick the first one. The next one is yes, you will. 2, probably no. And the last one is you're still unsure, which means that we may have to do another session like this. Okay, yes, that should be enough time for you to answer. In case you need a bit more time to rethink, we'll give you another 2 seconds. Okay, can we have the poll question number 3, please? Poll question number 3, how safe is COVID-19 vaccination for 5 to 11-year-olds and children? This is from your opinion, right? So number 1 is depends on the vaccine. Number 2, it is quite safe. Number 2, 3, unsafe. And number 4, you still don't know despite everything that we've said in the last 1.5 hours. Please answer the question within the next 10 seconds. Okay, so thank you very much. I'd like to thank the 4 panelists and also the president of the MPA for taking their time off on a Sunday afternoon from their family to actually share the information with you. I'd like to thank also all of you who have taken time to listen to us, and hopefully what you have gained from here will be of some use to you in your decision to whether to vaccinate your child or not. And we hope that as Dr. Musa and Dr. Amar has said, we are pediatricians. Our concern is just for the health of the children. We have no vested interest. We don't get anything from the vaccine companies, neither do we get. And these people who are in front of you now actually do not get paid to spend this 1.5 hours here. And also we have people who are working in the background, the Secretariat from Immunize for Life, people like Stephen, Sean, Mariam, and Darius, and the others, who are actually making it possible for us to connect using Zoom as well as using Facebook. And we apologize for the hitch with Facebook earlier on, and probably with Zoom as well. Hopefully it's been corrected. I don't know, because I'm in the front here. I don't know what's going on in the background. So thank you very much for your time, and have a good the rest of the weekend. And please stay safe and get yourselves and your children vaccinated, your family vaccinated. Thank you, and Assalamualaikum. Good evening.
Bye, everyone.
Are we offline now?
John?
Hang on just a sec.
No.